Hello, hi, how are you? Hi, Joe. Hi. Good afternoon to everybody on the West Coast. Almost dinner time Central, evening on the East Coast. Super happy to be beginning a new week with all of you. I got up early this morning to co-anchor with Hoda, and that was really fun to see a friend, even if it was just through technology. So I'm in a good mood, and I'm super excited to be talking with Dr. Anthony Fauci in just a few minutes. I've been trying to talk to him for several months now. I know everybody's trying to talk to Dr. Fauci. I'm an admirer of Dr. Fauci. I have a great deal of respect. He has served 6 presidents, which is quite extraordinary. Quite extraordinary. I don't know anybody who's served 6 presidents of the United States. So that in and of itself is an achievement. Presidents from different political parties, all the while serving his country. So I know many of you, hundreds and hundreds of you, have weighed in with questions that you wanted me to ask Dr. Fauci. I almost got overwhelmed with the amount of questions that came in. So I asked my daughter, Christina, to stay here and help me with all the questions that everybody has asked me to ask Dr. Fauci. I'm going to try to get through some of them. They've been kind of categorized in back to school areas, who can you not socialize with, vaccines, mental health versus physical health, mass safety. So I'll try to kind of lump a lot of questions. Originally, I thought, well, maybe I'll just name people's names and ask their questions, but there were so many. And we have about 30 minutes, though, with Dr. Fauci. So I'm really excited to talk to him, to try to maybe weave through some of the confusion that's out there, certainly that exists in my own household and in my own mind and pretty much everybody else I've spoken to. So I think many of us are in the same boat. I know people with small children are wondering about schools. I know grandparents are wondering about when they can be reunited with grandchildren. I know people who have parents in nursing homes are wondering about the safety of those places when they can visit. People wondering about whether they can go back to work, whether they should wear a mask, should not wear a mask. The questions are endless. So the man of the hour, the man that can answer them way more than me, is the one and only Dr. and also educated by the Jesuits. So, oh, there's a good question. How is Dr. Fauci himself doing? That I really would like to know. That's a really good question and might be a really good place to begin, because there he is. Hi, Dr. Fauci.
Hi, Maria. How are you?
I'm good. How are you?
Very well, thank you. Very well.
Let me begin with a question that just came up. People saying, I want to thank Dr. Fauci for all he's done, and I want to know how he is doing personally at this moment in time. So let me ask you that.
I'm doing quite well. I am. To say that I'm not stressed is being dishonest, Maria. But I'm doing fine. You know, it's a very intense situation because the country's dealing with a really serious problem. And, you know, and it just is very consuming. I say somewhat facetiously that I'm running on fumes, but the fumes are really thick. So,
yes.
So they're maintaining me.
So you're stressed, but managing. Is that a fair assessment?
Yeah, no, I mean, I'm doing fine. This is a very important thing. I mean, this is my life's work, Maria. I mean, I'm an infectious disease person. I've been chasing outbreaks since the very beginning with HIV back in the early 80s and Ebola and Zika and all that other thing, pandemic flu. So this is really quite a serious issue that deserves the energy and attention that I'm giving it. I mean, obviously.
So Dr. Fauci, you say this is your life's work. You have been chasing infectious diseases throughout your life. How would you state where we are today? What is the status on this Monday for all of us in the United States, really? Are we in stable condition, critical condition, serious condition, or an alarming condition?
You know, Maria, it's a mixed bag because there are certain sections of the country that have gotten hit badly, that are doing well now, that are recovering, that are opening up in a measured, prudent way without any surges. But as we know, just from following the news, it's been a very difficult situation in certain of the southern states particularly Florida now, Texas, Arizona, California, where the surges have been significant and have actually led to, record amount of cases on a daily basis. That's something we've got to turn around. So when you think about what's going on in that area of the country, that is quite serious. But the thing I don't want people to think that we should just throw our hands up and say it's futile. We can't do anything about it. There is a pathway.
What is the pathway?
The pathway of turning that around is some things that I call fundamentals. And that is, we know from experience in our own country as well as experience in other countries that right now, if you want to stop these surges and get them back down to baseline, there are 4 or 5 things you can do that we know. 1, masks, wear it universally. 2, close the bars. People congregating in bars, indoors, is just not a good idea. Number 3, keep social distancing. Number 4, when you have restaurants, limit the seating, indoor restaurants. Outdoor is always better than indoor. And finally, personal hygiene, just wash your hands. Those things, relatively speaking, Maria, are really simple. If we did those things very strictly, we could turn around what's going on right now. I was just on, like a couple of hours ago down at the White House on a governor's call where Vice President Pence and the task force were speaking by teleconference with several of the governors, and we were bringing that up in very emphatically that if we do that, we could turn around those surges in those countries.
Did you ask those governors to mandate mask wearing?
That's obviously a very sticklish thing. That I'm one for, if it's not working, mandate it. But I'm one voice among many. There are others who want to make it mandatory, but strongly encourage it, because there is a pushback, obviously, about things that get mandated. But I think this is serious enough that we really all should be wearing masks when we're outside.
So the president just tweeted a few moments ago, about an hour ago, a picture of himself wearing a mask and saying some people have said that it's patriotic to wear a mask. And so I'm wearing a mask because I'm a patriotic president. Do you think that will help? Because he has not so far mandated mask wearing. Right. He hasn't even suggested that he would be wearing a mask. He's only been photographed once. Will that make a difference?
No, I think the president was making a good point that if he wears a mask, it would encourage others to wear a mask. Vice President Pence wears a mask when he goes out right now. I mean, it's less. I wish he would get out of the political arena and just understand it for what it is. It's a public health mechanism. That's really what it is.
But how do we get it out of the political arena? It seems like in Europe and Asia, it didn't get into the political arena, and everything gets politicized here in the United States. Why is this politicized here in America?
You're asking the famous existential question, Maria. It's just the nature of our society and where we are right now with the divisiveness that's going on. And that's something I hope we can put aside, both sides of the aisle, just put it aside and get down to the business of containing this outbreak, because we can do it. This is not something that's insurmountable. If we pull together as a country and not argue back and forth about things that are distracting, we can turn this around. We have faced greater challenges than this in our history. We can do this.
The president said also that he's going to resume his presidential briefings in the afternoon starting tomorrow. Will you be joining him in those briefings?
I would assume I am. I mean, I have not gotten official word of when the next one was. I was down at the White House just this afternoon. If they start the briefings, I would imagine I'm going to be part of it, at least some of them.
But they haven't asked you to come tomorrow and join the president?
Well, I don't know if there's even going to be a briefing tomorrow. I don't know that.
So you haven't been told that yet?
No, not yet. I don't think there's been any firm decision about when they will start. But that's, I just tell you what I know and don't know. I
But
haven't
you,
heard.
but if
No,
they
I've
do
heard what you
start, you'll
said.
be there.
Yeah, I've heard that they want to start them. I don't know exactly what day they're going to start them.
But the bottom line is, if they begin again, we can count on seeing you standing there and telling us what we need to know and what's going on right now.
I would imagine so, yes.
You look forward to that.
I do. I do. I think it's very important to communicate with the American public because they need to hear the important public health issues and how they could essentially utilize them. You know, I've always said, and I'll say it again with you, Maria, that we need to open the country because there are so many deleterious consequences, but we want to do it in a way that's prudent and careful. And we shouldn't look at the public health measures as an obstacle to opening up. We should use prudent public health measures as a gateway or a vehicle to safely opening up. So what we've got to do is to bring those things together because there seems to be that conflict. Some people say, if you do public health measures, you're getting in the way of opening up. No, I think one can actually facilitate the other.
But there is so much confusion, when you agree, Dr. Fauci, about how do we open up? How can we do that safely? How can we bring this virus to the ground and wipe it out and still get people back to work, still socialize, still take care of people's mental health? Isn't there seem to be confusion around how we actually can do that?
Well, you know, there doesn't have to be confusion, Maria. I think if I can just, I won't repeat it because I said it, the fundamental things that I just mentioned that everybody could do, there's nothing confusing about that. It's pretty straightforward. So if we all did that, I think we would take, you know, a pretty much of a giant step towards where we want to be.
But I wash my hands, I socially distance, my kids too, but then they go out, they go to work, they come back in. I mean, there seems to be a lot of confusion with people about, okay, I live with an essential worker and yet I still want to go see my mother. What are the rules around that? Who can I see? Who can I not? I can only wash my hands so many times. I'm wearing a mask, but other people that I'm in contact with aren't. I'm confused. How do you balance your physical health, your mental health, and trust everybody is doing what you say?
So let me try to unconfuse you.
Okay. I'm not alone here.
I know you're not. I know you're not. No, you make a very good point. So the issue is you can go out, but if wear a mask, try as best as you can, because physical distancing is one of the most important things in addition and complementary to a mask. So when you're out, you can do many things and still maintain a 6-foot physical distance. Sometimes it's impossible to always stay 6 feet from someone. That's the reason why you wear a mask at all times when you're out. Avoid crowds. You can do a lot of important functions in your life without ever getting into a crowd. So don't do that. Stay away from places where people congregate. And there was something that should be done that transcends you because you don't have anything to do with that. We should close the bars until we get this under control. Because it's very interesting that if you look at the statistics of late, the things that are driving the surges in the states that I just mentioned, the age average of the people who are getting infected, first off, is about a decade to a decade and a half younger than what we saw earlier on. So what happens is that the young people get infected. They sometimes have an attitude of, I'm living in a somewhat of a vacuum. It doesn't matter if I get infected because the chances are that I'm not going to get sick and I might even be completely without symptoms. That is true, but that's a bit misleading because if you look at it only in the context of yourself, you forget the fact that by getting infected, you're propagating the pandemic. Because by your getting infected, even if you don't get any symptoms, you would inadvertently or innocently infect someone else, who then likely would infect someone else, who then would infect someone who is susceptible to a deleterious outcome, like an elderly person or someone on chemotherapy for breast cancer or an immunodeficient child. So even though you think you're not part of the problem,
Yeah.
because you're safe, because you're young and you're healthy, you are actually part of the problem. So if we can get people to realize and understand that societal responsibility, then I think we can turn this around.
Do you think that the scientific community, Dr. Fauci, bears any responsibility for confusing messaging around all of this? I know in the beginning it was you don't have to wear a mask, and I know you said that because there was a shortage of PPE masks and you wanted to keep those for the doctors that needed them. But there was a lot of confusing messages. This could only happen to older people. And now those confusing messages are seeping into the whether schools should reopen or not debate.
Yeah. Well,
Does
I
the
think,
scientific community bear responsibility for some of that confusion?
you know, theoretically and maybe practically, yes. But there is something when you say the scientific community. Science is a process of looking at data when you have the data and making a decision based on what you currently know. The beauty of science is that you continue to keep an open mind so that when more information comes in, you could modify policies, modify behavior. If you just close yourself like a trap door and said, in March or February, we knew this. I don't want to know anymore. Forget about it. You don't do that. As the weeks and months go by, you learn more and more. And that's exactly what happened with the issue with masks. There was a shortage, and we were encouraged not to consume all the masks, but something else happened with the mask. It became very clear that people who were without symptoms could transmit the infection. So the only way that you could know, because if someone's walking around with no symptoms, you say, well, I'll stay away from someone with symptoms. But if someone is transmitting it without symptoms, the only way you could mitigate against that is by everybody wearing a mask. So that's how the recommendation evolved from early on, from, well, you don't need a mask, to we really do feel we need masks now.
So what do you know now that you wish you would have known in February or March?
You know, I just mentioned one of them, Marie, and it's worth repeating. What we didn't know was the extent to which there was asymptomatic infection and the extent to which you could transmit it. That's what we think. What we wished we knew then, really early, was the incredible efficiency with which this virus is able to transmit from person to person. Because remember, the first we heard of this virus was when the Chinese said it had jumped from a species in a wet market, like a bat or an intermediate host, to a human, and it didn't really spread very well from human to human. It was mostly an animal to human infection. And then all of a sudden we found out, as we gained more experience, that not only could it spread from human to human, it was spectacularly efficient in being able to spread from human to human.
So there's a lot you probably will know in a month from now or 2 months from now that you don't know today. Is that fair to say?
You know, I think there will be things. I think that the volume of what you learn from early on to now is much greater than the volume that we'll learn from now till 6 months from now, because a lot of stuff was completely unknown early on. I think we will continue to learn and we will continue to benefit from experience, but I don't think it's going to be as dramatic as going from the first day to where we are right now.
So let's talk vaccine, Dr. Fauci. So many people I talk to say, I'm not going back to work until I get a vaccine. I'm not going to a restaurant. I'm not traveling. I'm not doing this. I'm not doing that until I get a vaccine. Then a whole bunch of other people are going, I'm not going to take that vaccine. I don't think that vaccine's going to be safe. They're speeding it up. They won't have done all the trials that are necessary. It won't be safe. Where are we? And where we are, is it going to be safe?
Okay. So you've just given a description of both ends of the spectrum. Okay,
yep, that's what I'm here to do.
Okay, no, that's good. We'll address it. That's fair.
Okay.
You're being fair. So
Okay.
let's take a look at not doing anything until we get a vaccine. That's unrealistic, because there are good public health measures that we can do, and we can safely and prudently try to open America again, even in the absence of a vaccine. If we do things carefully, we abide by the fundamentals that I just mentioned a few
Yep.
minutes ago, I think we can do that. However, a vaccine, a safe and effective vaccine, would really be the showstopper and the game changer for us with regard to this vaccine. So you don't need a vaccine to do many things. If we get it, it would be a game changer. So now the second part of your equation, people say, why would I want a vaccine? How do I know it's safe and it's effective? Well, that's the reason why you do the clinical trials that we've already started and that we will amplify over the next weeks to months. We're going to go into a phase 3 trial to determine if one of the candidates, and there are at least a half a dozen that we're dealing with, if one of those candidates is safe and truly effective. So we will put every effort into do a properly designed and executed clinical trial so that at the end of the day, we'll be able to say or not that we have a safe and effective vaccine that we encourage everybody to take.
So, but that vaccine, people say like, well, when I get a flu vaccine, I get the flu. Am I going to get a COVID vaccine and get COVID? Seriously, that's what people say.
I know, and that is misinformation that we have to correct. You don't get flu from the flu vaccine. You could get vaccinated and still get flu because the flu vaccine is not 100% effective, but it's very beneficial. What we hope is that the COVID-19 vaccine will be safe and will be highly effective. I can't give you a percentage of how effective it would be. I hope it's 90% effective, but quite frankly, Maria, I would be satisfied if it was 70 and 75% effective, because that amount of efficacy would go a long way to really dampening down the outbreak.
Is it true that you need volunteers for these trials? And if so, where do people volunteer if they so wanted to?
Yes, in fact, we have a network, a COVID prevention network, COVE-PN, which has a website that allows people to sign up to volunteer, either for prevention or treatment trials, mostly prevention. We have over 100,000 people, and it's only been up for literally a week or so, who've already signed up. So we do want to get people to volunteer. We want it to be a very good representative of the diversity in our society.
Right.
Because you don't want to do trials that are only involving, middle-class white people.
Right.
You want to get people who are going to be susceptible to the infection, who would benefit from a vaccine. And that's the reason why we're having community engagement and community outreach to get a wider range that represents diversity ethnically, economically, age-wise, underlying condition-wise.
So repeat that again, Dr. Fauci. If anybody out there, male, female, young, old, whatever, wants to be a part of one of these trials, they can go and sign up. Is that correct?
Yes, they can volunteer, right.
They can volunteer, and we'll put that up. We'll put it up and we'll pin it. I don't know how to pin it right now, but we'll pin it. Okay. But many of the questions also, Dr. Fauci, that people wrote in, and I was inundated with questions for you. Many of them dealt with school reopenings, right? So many people struggling with, should I send my kids to school? Should I not? Be it in grade school, be it college. What is your take? If you had young kids, would you send them to school?
Yeah. So here is the way we got to look at it, because it is not a unidimensional thing for the country. So when I engage in this conversation, I'll do it with you, Maria, is what is the fundamental 40,000 foot principle? The fundamental principle is that we should try as best as we possibly can, within the context of attention to the safety and the welfare of the children and the teachers, to open the schools and get the children back. That should be the default position, that's what we want to do.
Right.
Having said that, we live in a big country that's very diverse, that has a great deal of diversity in the level of infection. So there will be states, cities, counties where there's virtually no infection activity. you don't have to worry. You could open the schools without any problem there. But we have to admit that there are places in this country now, states, cities, counties, where there's a fair amount of infection activity. Where there is, then you make the choice. A, do you open the schools? And if you do, what do you do to mitigate the chance of there being infections in the school? And there are there's a lot of creative ways to do that, Maria. You could do it by alternating schedules, morning, afternoon, alternate days, a hybrid of either days in school, days online with the computers. The paramount thing is you got to keep the children and you've got to keep the teachers safe. But you've got to try as best as you can to open those schools.
And is that, do you think, because it's important for children's social and emotional learning, for their mental health, to go back to school?
Yeah, there are so many reasons why you want to get the kids back to school, underscoring, as long as it's safe for them. A, it has a major downstream ripple effect with the parents. Right. What are the parents going to do if the children are home? They're going to have to modify their own work schedule, which interferes with a whole, cascade of effects. And a number of organizations, including the American Academy of Pediatrics, talk about the deleterious effects of children if you don't keep them in school. Some children, it's an important part of their nutrition is getting fed with lunches in school. Yeah, right. I mean, there are so many important reasons why we need to get the children back to school.
And also college kids, so many people also wrote in saying, I don't know if my kids should go back to college, and if they do and they come back, will they infect me? So many really basic day-to-day life questions. I live with an essential worker. What should I do? My kid wants to go to college. What should I do?
College is a bit different, because if you look at how some of the colleges are getting more of a consideration. If you have people who come from out of town and go into college, and it's mostly where people live, then there are some plans to maybe test everybody before they go in, and then intermittently do surveillance testing. Have a place that when you identify a student who is infected, you could safely put them in a place that's sequestered from the other students. That could be, I've spoken to some college presidents who talk about the fact that they even have a dorm that's designated for that. There are so many creative ways to do that.
And Dr. Fauci, also finally, one of my big passions is Alzheimer's, and so many people have written in about the travesties that have gone on in nursing homes all across this country, particularly here in California, people wondering, when will I be able to go back? Can a parent be safe in a nursing home, in a memory care facility? When should you be allowed to go in and visit a parent? What's the best advice you have for the people that are in nursing homes and families that are dealing with that situation?
Yeah, obviously that's a very sensitive situation.
Right.
What, at the task force meeting just this afternoon where I was at, Asima Verma, who's the administrator of the CMS, was there. And what she and her colleagues are doing are really trying to get a program, and they're being successful in protecting the nursing homes. In other words, making sure that absolutely pristine infection control and infectious prevention processes are in place. Testing people, making sure that the workers who take care of the people in there are tested, are shown to be not infected, are monitored, have masks, don't move them from one nursing home to another, because that's how you transmit from one to another. Try as best as possible to keep them in the same place. So right now, protecting the vulnerable is an absolutely critical priority. And without a doubt, as we all know, nursing homes are a vulnerable place.
Over the weekend, the president described you as a little bit of an alarmist. Is that a fair description? Are you alarmed?
I consider myself a realist as opposed to an alarmist.
So that's an unfair description, or you kind of more, you're dealing with reality, as you would like to say.
I believe so. But then again, others have different opinions.
Are you hopeful that the United States will turn a corner, that we will get this under control before the fall, before the winter, when everybody's saying people will go indoors again? Or do you think we're going to see another spike or a new
Yeah.
phase?
You know, thank you for bringing that up, Maria, because that is really the challenge we are facing today in July, is that when we went up and had our peak, we came down, and unlike many of the European countries, when they peaked, they came down really to baseline. Baseline being tens and maybe hundreds of cases, not thousands and tens of thousands of cases. Unfortunately for us, when we went up and we came back down, we plateaued at about 20,000 cases a day until recently, when we've gone up to 30, 40, 50, 60, and even 70. If we want to go into the fall and winter in good shape, we have got to get that down to a real baseline. And a real baseline means tens and hundreds, not tens of thousands.
And just in conclusion, to get to that place so that we can go into the fall, it can't just be those 5 things that you said. It can't just be washing your hands, wearing a mask, practicing social distance. It can't just be that. That's not just what they did.
No. But what they did is they did something a little bit different now. It's a little bit complicated. When we shut down early on, we didn't shut down 100%. If you look at the country as a whole, we shut down to the tune of about 50, 55%. You look at Italy, France, Spain, when they shut down about 90+%. So they really crushed that curve and got it down.
But how do we do that? How do we do that without closing down?
I don't recommend that we just lock down again. I believe, Maria, that if everybody consistently does what the simple things that I mentioned to you about social distancing, avoiding crowds, wearing masks, you will be surprised how incredibly effective that will be in turning things again.
So you'd mandate it, even though you're not in a position to mandate it.
I'm not in a position to mandate anything, but I strongly suggest it.
You strongly suggest, and you strongly believe that if everybody, 90-some% of the country, did those things, we would get to where Europe or Asia is.
I believe we could. I believe we would at least approach that.
Are you hopeful, Dr. Fauci?
Yes, I am. You want to be just adjectives to describe me. I'm a realist, but I'm also an optimist. I'm a cautious optimist. And I have faith in the American people. And if you look at what our country has gone through and the things that we've endured throughout our history, heck, we can do this. We can do this. We've all got to pull together, because the only way we're going to do it is together. When we go off in different directions, then we'll be shooting ourselves in the foot. We've got to do it together.
Well, Dr. Fauci, I want to thank you so much. I know you have a big day on Thursday. You're throwing out the first pitch for the Washington Nationals. Is that something that at least gives you a glimmer of hope in this moment?
Well, I would like to see a lot of normal things come back, and sports is certainly one of them. And being a big baseball fan, particularly a Washington National fan, I hope we get back. Yes.
I'm old enough to remember when the Senators were there.
Yeah.
Oh, and that's my daughter's birthday on the 23rd. So have a great first pitch. I want to thank you so much. So many people here said to thank you for your service, 6 presidents. And I know this has been stressful. I know you have a family of your own. And I know you live and breathe this every day. And I want to thank you as another American. I want to thank you. And as a former Jesuit, educated by the Jesuits, thank you.
Thank you for having me, Maria.
Thank you, Dr. Fauci.
Take care.
Okay, see you. So there is Dr. Fauci, extraordinary career working for 6 presidents of the United States. Many of you said a hero doctor, that's for sure. He spent 30 minutes with us, I think, bringing us up to date, calling himself a realist, saying he's an optimist, saying that obviously we cannot go back to a lockdown. Other countries did a 90% lockdown. He described us as being about 50 or 60% lockdown, but that there are specific things that all of us can do if we come together. There are very specific things. I was enlightened and hopeful that he said he was hopeful. That to me was really kind of inspiring, that he said that he's an optimist and a realist. And I think urged us all, regardless of our political affiliation, regardless of our gender, regardless of where we live, regardless of we're living in a place where there's not a lot of COVID, or if we're living in a place where there is, if we could all come together and do what he asked, then we can safely reopen. Kids can safely go back to school. Everybody wants the same things. So I think that maybe it was a step in the right direction for the president to tweet out a picture of himself today in a mask. Maybe we've kind of gotten over that hump. Maybe that's a step in the right direction. Maybe we can see Dr. Fauci back at these presidential briefings. That would be good. I looked forward to that, and I always like to hear what he had to say. And maybe we could all try to come together, follow the same guidelines, follow the same rules, and grind this COVID to a halt. And so I think he was really optimistic, and I think he spoke well to kind of understanding that we have to balance the economy of the country, people's mental health, their physical health. I thought he addressed the confusion that came about in the very beginning with a disease like this. There was a lot of confusion in the beginning. I think he said that, you know, those in the scientific community were learning as they went, and they'll probably still learn as they go. So I think he spoke to vaccines. I thought it was really interesting that he said people can volunteer. I had read that, so I was glad he addressed that, and we'll put up a pin with the address of where, if you want, you could volunteer to be in one of these trials. And very important that the trials are people of all ages, all races, all genders. That way we get the right information for people of all races, all genders, and all ages. And I hope that that brought some hope to people who have parents in nursing homes, memory care facilities, which has been a tragedy in and of itself. And I'm sure you'll be hearing more on your nightly news about whatever that meeting was that he had with the task force and the state's governors. I'm glad that they were addressing the nursing home issue, which has been such a huge issue in so many states, particularly here in California. And I know many people have spoken to me about that issue. So I wanted to address that, bring that up. And for those of you who find yourself in those situations, I hope you got some information. So I want to thank you all for so many questions. They came by the hundreds. I hope we tried to put them into areas, be it vaccines, schools, mental health, physical health, and masks. So very important. My daughter, who was my producer here, kept me on time, kept me focused, said to remind us all to wear a mask for ourselves and those we love. It's super easy. It's super easy to do. It's not political. It's for your country. And it's stylish. You can get them in all styles now, even. God. And if you want to get one from the Women's Alzheimer's Movement, you can do that too. So anyway, but thank you all so much for joining us. Thank you to Dr. Fauci for spending his time. God knows he is busy working morning, noon, and night on behalf of this country. So once again, let's try to be as hopeful as he is. Let's try to be as optimistic as he is. And let's try to come together as one, like he is suggesting, so that we can all take our children to school, visit our parents, reunite our families, and get the hugs that we all so desperately want from our fellow human beings. Okay, thank you so much for joining us. Have a great rest of your day.